Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to a new episode of Health. Fat or cholesterol has been in the blood, has been very talked about in the media, in the newspapers, in the magazines. Everybody's talking about your cholesterol. Cholesterol is going to kill you. What is cholesterol? People don't know even, and they still talk about cholesterol, and they're very afraid of cholesterol. Stop taking fats in your food. Stop doing this. We still talk about cholesterol, and we actually, most of the people, when they ask them, do you know about cholesterol, they don't know about it very well. So we're here to talk about cholesterol and your health and in your blood. And with us today is Dr. Ahmad Hosney, consultant and professor of cardiology in Ain Shams University, Cairo, Egypt. Dr. Ahmad, thank you very much for coming today.
Thank you, Dr. Ahmad.
Cholesterol. It's a mania. These days, everybody's talking about if you have cholesterol, you'll be dead. When you ask them what is cholesterol, they don't know what cholesterol. So I'm asking you, what is cholesterol?
Yeah, what you said is more or less true, because cholesterol is one of the what is known as lipid, which is part of the nutritions which we have. Together with it is also sensitized by the liver in the body. Cholesterol and other lipid forms, especially triglycerides, are very important because it play a very important role in different parts of the body. We can't say that it is totally unhealthy or it is totally dangerous, because you should have cholesterol.
It's normal to have cholesterol in your blood.
Yes.
That's okay.
You should have it in the blood, but in a certain quantity. This quantity is very important for different metabolic process occurs inside the body. And if you have these levels of cholesterol and triglycerides within the normal range, so you are totally away from having any abnormality in your body, and on the other hand you will benefit from the useful effect and the need of your body to this cholesterol. When your blood cholesterol level become elevated above a certain conditions or certain numbers, or you have other conditions, for example diabetes, so you have to be sure that your blood cholesterol level is even below normal to be away from any harm that may occur with this elevated level of cholesterol.
So when do we say that we have raised cholesterol or lipids or fat in our blood?
Actually, it is a laboratory measures of the lipid profile with special precautions. You have to be fasting for at least 10 hours. You can take water if you need, but if you don't need water, you are not allowed to have any other food or other drinks during the fasting period. After this period, you take a blood sample, and through a certain laboratory measures, we have a lipid profile, which is formed of more or less 4 or 5 parameters, all of which are very important because it gives us an idea about the level of the cholesterol, the level of the triglycerides, the level of what is known as the LDL, or the low density lipoprotein cholesterol, which is the harmful form, and what is known as the high density lipoproteins cholesterol, which is useful form, and other small molecules which is known as the very low density chylomicrons, lipoprotein, and so forth.
So I want you to make it easier for the viewer to know when he or she take or intake fat.
Yeah.
What happens to this fat and how does it reach all the way to the blood?
Actually, we have a video that may demonstrate what we meant by these forms. If we see here, this is the liver and this is the GIT. Fat enter the form inside the body by different form of food or food stuff. You may have through egg, through meat, poultry, fish, seafood, and dairy products.
Yes.
All these forms of food contain inside it more or less amount differ from one foodstuff to another, but at the end of the story, all these forms have fat that enter the body through the gastrointestinal tract. Actually, also the liver producing cholesterol through its cells and then goes to the blood. The other form with the triglyceride, as I said before, it is also entered the body through different foodstuffs, and through the GIT it's absorbed to reach to the circulation. This is known as the triglyceride. This is another form of lipids. Actually, these forms of lipids, either cholesterol or the triglyceride, are stored in the body in forms of fatty tissues through a certain type of cells, which is known as the adipose tissues, to be used in different
So this is what
body.
makes us fat.
Yeah, this is
This
what
is
makes
what makes us
fat, yes.
to accumulate the fat as storage in the fat cells.
Yeah, yeah.
So when you say there is a good lipid and there is a bad lipid or hazardous lipid,
Yeah.
let's talk about the good part first. What's good in cholesterol and other fats that we have in the blood?
Cholesterol and other fat of the body play a very, very, very important role in different metabolic processes inside the body. We can say that it enters in the synthesis of the cell wall of different cells of the body, especially the cells of the brain. And when cholesterol decreases extensively from the circulation, this may make some abnormalities like dementia, for example. It is induced due to a lack of cholesterol, so don't be obsessive enough to make your cholesterol very low. Also, some speak about cancers and its relation to low cholesterol levels. So
Low cholesterol,
yeah,
yes.
low cholesterol levels. So you
Yeah.
have to be sure that your cholesterol level is low, but in its way to do its job, not to be deficiency and inducing harm to the body. So cholesterol increase or cholesterol decrease, both of them are harmful. You should be in the border zone according to your situation. This is a very important issue. We have to discuss it. What we differ and what we argue about it, what is the normal level of cholesterol?
Yes.
What level you want me to have to be in the safe zone and be away from being hypo or low or hyper or high? This is the question which is more or less changing day after the other in this era. But other functions of the fats or the cholesterol also, it enters in the synthesis of different hormones.
Hormones.
These hormones, of course, very important to the body, because when these hormones decreases, it may induce other harms, and the source in this situation will be due to the decrease the amount of cholesterol. It may also play an important role as an insulator. When fat is present inside the body, it will prevent decreasing the blood pressure inside the body when it's exposed to cold weather, for example. Here is a demonstration inside. Shows that the functions or other rules of cholesterol inside the body. The first we spoke about insulator. The others we spoke about it support different organs of the body, especially the heart. It also is very important for transportation, absorption, and digestion of vitamins and production of hormones, as I said before. This is more or less the functions of cholesterol and its importance inside the body.
So having fat is in the body is very essential.
Yeah.
And it's useful. It's not that bad for yourself.
Okay, but
Yes.
in a certain
In a
situation, certain amount.
Yes. So on the other side, if you have extra fat in your blood, what does that do to you?
Actually, it is very dangerous, because this fat, when it increases inside the circulation, it should be deposited in different tissues of the body, especially the blood vessels, and inducing what is known as atherosclerosis. This is a very dangerous situation because it precipitating different diseases. The dangerous is inducing angina or myocardial infarction to the heart. It may induce something in the retina and the brain, the kidneys, in the lower limbs. Different organs, when it's affected by the position of fats inside it, it will induce a very, very harmful situation, and maybe in some situations it's life-threatening.
Life-threatening, so atherosclerosis. I'm sure many of the viewers know the word atherosclerosis, but they don't know how bad could it be
Yeah, it's very bad, as
to
I
the
said.
body. So,
It may be as harmful as being life-threatening in certain situations.
So it has to be a balance between having fats in your blood, but still it has to be not that very high. So keeping this balance is very difficult for most of the people, especially those who would love to have the greasy or the fatty food, or the lifestyle of their food is more to the fatty stuff, especially the junk food that our kids do love. And
Yeah.
actually, unfortunately, they use more of the fat in their food, which might lead on the long term to have excess or extra fat in their blood.
Totally true.
Definitely. So we have a short break. and then we'll be coming back to talk more about this, this problem and the balance between the good and the bad lipids and the good and the bad cholesterol. So, brothers and sisters, we have a short break. Please don't go away. We'll be coming back in a few minutes. Until then, Assalamu alaikum wa rahmatullahi wa barakatuh. Dear brothers and sisters, Assalamu alaikum wa rahmatullahi wa barakatuh. And we're back and we're still talking about cholesterol in your blood. And as we have known in the earlier segment, cholesterol is important for you. It's not that bad at all, unless it's a high cholesterol. Dr. Ahmed, we were talking about a person with a high cholesterol. How do I know that I have high cholesterol? If somebody is fat, for example, they should expect themselves to be having a higher cholesterol blood level?
Actually, obesity or increasing weight is suspecting you have a lipid profile which is elevated, but on the other hand, being slim does not mean that you are with normal cholesterol level.
Yeah.
So you may be slim and your lipid profile is abnormal. This is a very important message which I want to send it to all the audience here, is that the body weight, although it may be a positive indicator for having dyslipidemia or elevated fat in the blood, but on the other hand, if you have a slim body, this does not mean that you have a normal lipid profile. So I think clue here is measuring the lipid profile. And we can say that there is a cutoff age, for example, around 40 years, above which you have to do a lipid profile at least once yearly.
Yearly?
Yeah.
Yes.
To be sure that your lipid profile is normal. This is, of course, together with providing the underlying precipitating factors that may inducing elevation of your lipid profile.
Precipitating factors like what?
Precipitating factors like sedentary lifestyle, don't do any type of exercise, this is very risky. Smoking is very risky.
Yes.
Stressful lifestyle, eating a large amount of fat and junk food and fast food, something like this is very dangerous.
Yes.
Having a family history of atherosclerosis, this is also very dangerous because there is some sort of hereditary forms or genetic abnormalities with which dyslipidemia occurs or elevated blood fat occurs. Also, being male, for example, this carries a higher risk to have atherosclerosis and having a higher, unfortunately. Also, the white races are more susceptible for hypercholesterolemia than the black ones. So if you have any form of this, you have to take care and you have to measure blood cholesterol to be sure that it is normal.
Yes. So are there many types, just having high blood lipid or cholesterol in the blood, or are there different types of this?
Actually, as I said before, there is two main types of lipids inside the body, which is the cholesterol. This is the major form and maybe a dangerous, the most dangerous form, but there is other forms of elevated blood lipids, which is the triglyceride, hypertriglyceridemia. The patient may have hypercholesterolemia alone or hypertriglyceridemia alone, or may have a mixed form of both elevated level of cholesterol and triglyceride. Each one of these has a different medication which helps you together with the non-pharmacological treatment for solving the problem.
Yeah, so this takes us to the complications or the problems. You mentioned the atherosclerosis.
Yeah.
As the major problem that could happen because of your high fat level. Is that the only problem that could happen around the high fat level in the blood?
No, it's not the only, but maybe the most dangerous.
The most dangerous.
Complication or sequelae of neglected elevated level of cholesterol. This film may demonstrate other forms of abnormality. As I said, there is a good form and the bad form of cholesterol, but when these bad forms are increased, it may induce what is known as the plaque, atherosclerotic plaque. The presence of this atherosclerotic plaque is very dangerous because it's not only inducing narrowing of the blood pressure and making you more susceptible for having an attack of ischemia according to the area which is affected by this plaque. What I mean, if this plaque is present in the coronary circulation, I mean that the blood vessel that supplies the heart, so you will have a heart attack. If this vessel is affecting the brain, so you will have a brain attack or what is known as a stroke. If this occurs in the lower limbs, you will have ischemia in the lower limbs, which is known as claudications. All these are because of the presence of this plaque. Also, this plaque inducing rigidity of the blood vessels, so it may be one of the precipitating factors of elevation of the blood pressure and inducing, as I said before, hypertension. So this is atherosclerosis, which is very risky, restricting the blood flow to the target area which it supply, but also there is other forms, as I said, like inducing hypertension, systemic hypertension, inducing heart failure, inducing coronary disease, as I said, if it is affected artery. It may affecting also the peripheral circulations of the limbs. It may inducing strokes or even may inducing cerebral hemorrhage.
Yes. So it is a problem that you have a high fat level in your blood, and of course, as we saw in the video and as you've said, it might lead to serious problems.
Yeah.
So this takes us to the management of this problem and how to avoid it first.
Avoiding, it's better than treating.
Yeah.
Except in a very limited situations in which a hereditary play a very important role. These patients are really at risk and they may have no other risk factor. They do exercise and they are not smokers and they are restricting fat in diet and so forth. But even with this all measure, their blood cholesterol level is elevated. This is related to the synthesis of the lipid inside the liver. But at the end of the story, we have to say that protection is better than treatment, and you have to take care of yourself, especially above the age of 40, and you have to take care of the amount of fat you take every day. You should do some exercise. You have to stop smoking if you are a smoker. All these maneuvers, if you do it, of course, you have to reduce your weight. If you are obese, you have to reduce this obesity. You have to have a standard body weight. If you have other conditions like diabetes, for example, which is dangerous because both diabetes and abnormal lipid profile are two faces of the same coin. You can't control one without controlling the other. So if you have dyslipidemia and diabetes, you have to control the blood sugar also to have your blood lipid profile also normal. According to your risk maneuvers, you may begin with treating the patients up to 9 months with non-pharmacological treatment, as I said.
Just taking care of the...
Yeah, taking care of what I said. After which, if he has no response with these maneuvers or non-pharmacological treatment, he have to take a step forward by taking medications for this treatment. For
Recently, some of the new, I wouldn't call them drugs, I would call them, I don't know, commercial medication or on-shelf medication that gives people a very, very good thing. You tell them, eat as you want, and just take these, and it will prevent the fat from going into your body, and just like enjoy your meals and don't get fat.
No way.
Yeah.
All this doesn't work. These medications or these on-shelf tablets, if you want to say, helps to decrease the amount of lipid absorbed from the GIT which you take. May be true,
yes.
But you miss another important issue, which is the synthesis of this cholesterol inside the body. Also, it may decrease the amount of fat entered, but also the harmful type of LDL is still present, which carry the harm and the risk for developing atherosclerosis. So it is not a matter of just only reducing the amount of fat taken in food, but also there is another issue inside your circulation. You have to control it together with decreasing the amount of fat inside your body to make all the conditions moving in synergy.
But would it help?
Yeah, of course, it may help,
It might
but
help.
it's not the only way.
And are they safe?
Some of them are safe, some of them are, you should take it special precautions in certain situations. If you have certain conditions like the liver disorder, something like this, you have to take care when you take it.
Yes. So this brings us to the people who don't have the chance to get their cholesterol or lipid level reduced just by taking care of themselves and doing some exercise and all that. So this gives us takes us to the next level, which is the medication. What do the medication for cholesterol, high fat level in the blood do? I mean, what does it target?
Yeah, some of them targeting, again, the decreasing the amount of fat absorbed from the GIT, but other works at the synthesis of cholesterol and LDL inside the liver. They abrupt certain part of the circuit of synthesis of cholesterol to decrease the amount of cholesterol sensitized by the liver. So if we decrease the amount of fat absorbed from the GIT and decreasing the amount of cholesterol sensitized inside the liver, so the total amount of cholesterol and the LDL is decreased. And then the HDL, or the high dense lipoproteins, which is important to protect the body from the harm of cholesterol, just elevated by doing exercise and stop smoking. There is no medication up till now elevating markedly the HDL. So, as I said before, we have to combine between the non-pharmacological, because it's very important to elevate the HDL, and between the pharmacological to decrease the LDL and the cholesterol.
So would the medication keep on going, just like other diseases like the diabetes or hypertension? The person would have to take medication for life, or is it just for a certain period and then until the levels of their fat in the blood is adjusted and they just stop the medication?
Actually, this is a very good question, but there's two factors affecting the decision of being lifelong on lipid-lowering drugs or not. The first one is if you have other conditions, for example, if you are a diabetic, instead, beside being dyslipidemic, or if you have an attack of coronary artery disease or cerebrovascular disease, all this makes you advised to have these medications for life. But if you have discovered this accidentally or the first time of your life to have dyslipidemia, as I said before, and you are not diabetic, you have no family history of ischemic heart disease, cardiovascular disorders, we can begin with a non-pharmacological treatment that may extend up to 9 months. During this period, if the blood cholesterol level become good, so we will continue in the non-pharmacological treatment without adding any pharmacological treatment. But after this period, or the doctor find that there is no change in the level of cholesterol during this period, he have to take a decision to give him a lipid-lowering drugs. The amount of lipid-lowering drugs, once you begin, I think you have to continue for at least 3 to 6 months, after which you have to re-evaluate the condition. If it is good, you may reduce the dosage, but to stop it at all, I didn't think it will be a good thing or a good advice to the patient to totally stop, especially if he didn't stick to the non-pharmacological maneuvers, as I said.
Yeah. One final question that I have, or I get from most of my patients, especially those who are obese, is there a food that I can take? We know the food that we should not take or to reduce. Is there a food that I can take to decrease the fat in my blood?
Not decrease, but there is a healthy fat, especially nuts. This is a good fat,
yes.
A healthy fat, and a healthy food. You can take it, and this will increase the amount of healthy HDL, but it will not decrease the LDL. There is no food that decreasing. It may help, but it will not eradicate the problem.
Okay. Dr. Ahmad Hosney, consultant and professor of cardiology at Ain Shams University in Cairo, Egypt. Thank you very much for talking to us today about the cholesterol and the fats in your blood. Brothers and sisters, I hope that it has been beneficial for you this time to talk about the cholesterol and fat. Don't take greasy food, or at least try to reduce it if you cannot, and try to stay in shape, exercising, and of course stop smoking. All the advice we've heard from Dr. Ahmad. And inshallah, until next episode, I wish you a happy and healthy life. Until then, assalamu alaikum wa rahmatullahi wa barakatuh.